What we should hear is something about how we can provide health insurance coverage to the 47 million Americans who are currently uninsured. What we will probably hear from President Bush, though, is a warmed-over version of his proposal from last year, which would move people from the employer market and group coverage into the individual insurance market, which is a really dysfunctional way of providing health insurance coverage for the few people who are there today. Employer market for health insurance is really useful because it allows healthy people and sick people to be part of the same risk pool. And this means that costs are averaged across everybody who's in the pool. Given that 20% of the population incurs 80% of the healthcare costs, it's really important to have young healthy people and older sick people, or for that matter, younger sick people, all in the same pool so that the rate for everybody evens out and that variation doesn't hit any individual too hard. In the individual market, insurers just look at your own experience with healthcare and with the kind of health conditions that you have. So if you were to develop diabetes or to have a high-risk pregnancy or to have breast cancer, your rates would skyrocket up, and in fact you might not be able to purchase health insurance at all. If you're part of a larger group like you are in the employer market, that won't happen. The American public's been really clear that they want our healthcare system to change, that they want to be able to provide health insurance coverage to the 47 million Americans who don't have it. But we're not going to be able to do that in 2008 because President Bush and his veto pen are looming out there. But what we can do this year is to set up for change in 2009. We can improve healthcare quality right now and improve the efficiency of our healthcare system, for example, by making new investments in preventive care, by making sure that people can get the immunizations and the checkups that they need, that kids get the well child care that makes sure that they do well in school, and by making the investments in technology that make for a more efficient and also a safer healthcare system. If we do this, we'll be able to really take on the issue of the uninsured in 2009. This is a goal that we share. We need to set the table for reform today.